Coming to you live with the insight you need from the financials and political capitals of the world to the heart of innovation. This is Opportunities to Consider with your host, author, speaker, and corporate strategist, Hunter Gaylor.
Welcome everyone to another edition of Markets Hunter. I am joined today for another conversation with some of the team at PETV. The conversations have been going really great. Make sure you like and subscribe to all of our channels. We are growing at a very, very rapid rate. So thank you for all of the support on all the different channels. Make sure you follow all the companies as well, as we provide all of the links and disclosures and everything at the bottom of the videos and on across all of our channels. Twitter, we also want you to follow the companies because they're constantly updating. So if we're not providing the information, the companies are providing the information. We like to cover all of our bases. And with that being said, I'm going to bring in our guests, John Lai and Dr. Marie Bartling, Doctor of Veterinary Medicine. Thank you both for joining us back on the Market Hunters program.
You're welcome. It's a pleasure to be here.
So I just want to go in, John, we've heard a lot from you, but I really want to talk to Dr. Marie Bartling because she's got an incredible background in veterinary studies and in just her background from working with horses to dogs and really specializing in pain management, and kind of we were talking before the program. And so we really want to hear from you, Dr. Marie, on your background and what kind of led you to PETV and some of the products that they're working with today.
Yeah, you bet. So I've been a veterinarian almost 18 years, and I started in equine. So I always intended to be a mixed animal doctor, but focused first on horses. And horses are used primarily for sport. And so it means a lot of what we do as veterinarians is keep them physically well. And what's unique about horses and kind of started my journey is that they can't take typical daily pain meds at all. And it's the reason I started learning some of the alternative modalities like chiropractic and acupuncture and just anything I could to help them feel better and be physically active until they're old. And so in horses and in humans somewhat, the first line of treatment is actually a joint injection because we can affect the joints directly. We can inject them where they hurt, and it reduces their need for daily medications. So as I progressed my career into starting to work on small animals and then ultimately had my own injuries, so I had to work on small animals full time instead of horses, what I learned is that we kind of think that arthritis in any species is gonna be a degenerative process and that we are all gonna lose our mobility. And really, I have enough experience in horses to know that we can do better than that. A lot of our dogs and cats, if you will, are hugely painful, and we kind of accept that they lose their ability to get around well, to play with their other dogs in the house, to play with the kids, that they're just old. And that led me down a huge path of studying pain and knowing that some of this pain chemistry is reversible, that we can treat the inside of the joints and keep them healthy longer, and then ultimately live really well until we are old, until they are old.
So Dr. Marie, can you just go into a little bit of that? Obviously, we're joined by John, and they have a product, Spring, with their OsteoCushion technology. We have talked at length with John in the past about the technology and pain and really what it does for pain. Can you talk a little bit about your experience with the product, how you've seen the product evolve, and what the reception has been, not just from obviously the animals that you work with, but say the veterinarian industry as a whole?
Oh, you bet. So I think it's first important to recognize there are a couple different reasons that your body becomes painful when it's secondary to arthritis. And so Spring is a part of that process that we call multimodal pain management. The short is, if you have multiple causes for a problem and you don't address all of them, you will not have an optimal outcome. So it's important to recognize where it fits in the big picture. So in terms of how it works in my practice, the most important thing we recognize is first, yes, that the animal has pain. Young active dogs sit, stand, and walk differently. And so what we're really looking for is that they're just less efficient in how they move, because it might not show up in their affect and how happy they are, right? So once we identify where the problem is, we can treat it. Once we take down the systemic level of pain, inflammation, and then also spinal cord chemistry that is related to pain, we can use a product like Spring. So Spring is unique because it has resistance to compression as part of its biomechanical property. In other words, it's a cushion, right? There's nothing like it. There's nothing else on the market that's like it. I've used some polyglycan products, so things like Adequan, which we might know as a molecule similar to hyaluronic acid.
Okay.
Those products help provide joint lubrication and stimulate somewhat your production of joint fluid, which is important. And they can also bind water, which makes your cartilage feel a little bit thicker. None of them actually protect cartilage, and the other products we have don't last very long. We see benefits for a few months if we combine them potentially with a steroid. And so what's been really fun for me about using the Spring is that I have several patients that are out over a year right now.
Oh, wow.
And all of them have reduced their daily medications, which is, like I said, my chief goal in life, right? That we get to run and play, they get to run and play and not hurt and not have to take so many daily pain meds.
So obviously, when you said at the beginning of this discussion, let's talk about the equine community, the equestrian community. You said a very interesting point that a lot of the horses are used for, racing and some of these other things, right? Mm-hmm. It seems to me that there's a tremendous amount of wear and tear that would go into these horses' ligaments. Just as not a doctor of veterinarian medicine, it would seem to me just by watching it, they're put through very strenuous activities and training. How have you seen the product relate to that community?
Sure. Yeah. Hunter, you're smarter than you know. So what happens in the body when we use it a lot, when we create physical damage in tendons and joints, is that you get cumulative damage, which is how we get arthritis, right? So what we think of as arthritis is we think of it being degenerative old age disease. Oh man, is it not? So it means that these athletic animals, be them horses or dogs, that is the number one target group, right, for trying to prevent degeneration, right? It's useful. This product can be useful in all stages of arthritis and or tendinopathy. We're starting to see some evidence there too. So I would say that I have a number of dogs that have been able to go back to their daily sports. That means agility in dogs, right? And for horses, that means going back to show most of the time in the ring, right? In the show horse ring. So that's been my experience, is that yes, if we take care of their joints and include this in a multimodal component. So obviously injecting a joint means we have better cushion in there. It doesn't mean the muscles on the outside of the joint are flexible and strong, right? So this is part of a process. And when used with that rehabilitation, that recovery process, yeah, they come back to full sport in some cases, depending on where we started from.
Well, yeah, that's very interesting. And I know John and I have had this conversation before, just from the history of Pet Vivo and the company. I mean, I'm an avid, racquetball and tennis player. And, occasionally I do get a little because I'm using it so much, right? So, tennis elbow. And then, I like to do a lot of long distance running. And so I do feel sometimes wear and tear. But if, having this cushion, this injection, and it actually adds to the cushioning between the joints, to me, that really is a game changer, in the marketplace. There was one more thing that I wanted to ask you. There's a recent study that came out, and I just want to pull it up here for it was a clinical study involving Spring, and it was the VOS. It's the Veteran Orthopedic Society at their annual conference. There's release that came out, and we'll put it for our viewers with a link to the release. I just wanted to get your thoughts as a doctor on what this means and what the results were in general.
Right. So that kind of preliminary study was a study where they injected dogs stifle, which is their knee, with spring after those dogs had suffered an ACL injury called cranial cruciate ligament in dogs, but the same as the ACL in people. So what happens when you have a cruciate ligament injury in the knee is the knee itself is loose. And you can see how that sets it up for more damage every time you walk or run, right? That it's creating low-level arthritis that becomes really severe and often entails a lot of cartilage loss. So in this study, they took dogs that had this injury and then injected the spring and then measured out what their response rate for being able to bear weight and an pain assessment over a few months. And the outcome was that 64% of them were doing better. What's interesting about this is they didn't break down the groups yet into how severe that ACL injury was. In other words, if you have a partial ACL tear, say it's 30%, your knee is still not loose. You just have inflammation in there, and you're hoping it's going to heal. If you have a full ACL tear, it means the bones now are not connected together because that ligament is torn. And they didn't separate out those groups in this study. So I would suspect that the response rate will be much better than what is reported. And I would tell you that my success rate with this product when used in the right use case is well above 85, 90%. Right? You have to choose carefully. And like I said, respect the muscles and the inflammation and the other processes. This is really, really helpful product.
From an industry perspective, and this may not be a Wall Street question, just a practical question that I would have for you. As a person that has owned dogs in the past, have had dogs, have lost dogs, have run with dogs, what are the questions that we should be asking to our vets? What are the signs that we should be looking for as, pet owners? What are some of the things? How do we even talk to a vet? How do we say, I don't know if my dog is suffering or my cat's suffering. I don't know what to look for. I can tell you I'm hurting when I talk to my doctor, but how do we know what our dogs or our cats are communicating to us? And how do we communicate that to our doctors to say, hey, I heard about this spring product, can we try it? How do we communicate that to vets?
Yeah, I love your question. So we talked about how kind of physical medicine is evolving for dogs, right? So depending on the veterinarian you're talking to or the owner I'm talking to, we all have different vision of what that can be. The direct answer to your question is, if you think there's a problem, take video. And the most obvious way to see pain in dogs for me is to watch them get up and down. So take a video of sit, lay down, stand up. Then take a video of them going up and down the stairs. And then take a video of them just walking around. Because real-time assessment of pain is difficult, right? Mm-hmm. If you've had pain, you know that it's not the same every day, right? So when your veterinarian is trying to examine your dog, they may not see what you've seen. And we know that when the dogs come into the veterinary office, they're excited, they are interested in all the people, or maybe they're even afraid of all the people. And as veterinarians, we have this challenge that we are trying to figure out what's wrong and where the pain is based on exam and palpation. So if there's anything I learned about being a horse doctor is, oh no, you can see it. You can see it. And so I teach classes, and I'm teaching one this Friday for a group of dog trainers. And you can see, I have pictures I have a website for this I'm so glad you asked this question, right? Because you can see it in how they sit and how they get up and down. Just knowing that we optimize our physical function without thinking about it. In other words, if you hurt in your left leg, you're going to stand more on your right leg. And as you're walking, you're going to be stiff on one side, right? And so that's what I would take some video of. Whatever looks abnormal to you, and take it to your veterinarian and say, I don't know this is right. Help me.
So one of the things that, at least having looked at various, companies, and I'll say this once again, not a Wall Street question, but just basically a humanistic question. if I go in and I talk to my doctor about some sort of, drug or something that I read about that I may think would help me, or that I'm not interested in doing because I read of potential side effects, how do I go in as this product is now starting to roll out? And obviously, John has mentioned that they have one of the largest nationwide sales organizations, AmerisourceBergen, that they are starting to roll out the marketing and advertising of the spring product. But for people out there that may be watching, and I know a lot of people in our community do have dogs and pets, because we get all the messages on Twitter and LinkedIn saying, oh, this is great. How do you have an intelligent conversation with your vet that has not heard about spring? How do you speak to them about this product? They heard your interview. They've heard other veterinarians that we've had on the program. How do we ask the question to our vets to take a look at the spring product?
This is tricky. You're right about that. So I think it's important to bring any information that you have. So bringing a copy of the clinical study, if you really are interested in this product, will speak to your veterinarian as a scientist. So bringing information you have, connecting them to the website, right? If you really want somebody who doesn't know about this product to look at it, step one. Step two, if they are hesitant, so learning to do joint injections as a veterinarian in small animal world is pretty rare, actually. It's not a difficult tool to have once you learn the technique and I teach it. And so, you might consider calling the company. You might consider calling looking at the Spring Health website, call them and ask them for a doctor in their area that already knows what this product is and how to use it if you're having trouble. But I think your question is great. Is how do we talk to doctors about this? The best we can do is share information we already have in research and in case studies. So part of what I'm doing on my website is to share some of those case studies, and I'm happy for you to look at them, and they're downloadable. The Spring Health website also has really good case studies and some YouTube videos with before and after results so that those veterinarians can see what this is like.
Well, Dr. Marie, thank you so much. It's been such a pleasure speaking with you. Can you provide the website information where people can go to hear about your event that's taking place on Friday?
You bet. The website is called Help Spot Run, and it's largely education for veterinarians and some pet parent education. I also have some information about joint injections and arthritis in general on a website called VetVine, and that is open to pet parents and veterinarians as well. Okay, great. And John, always a pleasure to have you here. Is there any updates we should know about exciting developments from Pet Vivo coming out this week? I mean, we're coming into April, so hopefully some more studies.
Well, this coming weekend, Dr. Marie and Dr. Gaynor are going to be doing a wet lab demonstration at the International Veterinary Association of Pain Management. Did I get the whole title right? It's something like that. It's pretty long, and that one's in Atlanta, Georgia. So if vets are in the Atlanta, Georgia area and go into the conference, definitely drop by and see Dr. Marie and Dr. Gaynor do their wet lab demonstration, and we are a platinum sponsor of the event.
Oh, that's great. Okay, well, ladies and gentlemen, you heard it here first. So you can get a real live demonstration. So that'll be great. We're looking forward to it. John, thank you so much always for joining us on the program. Dr. Marie, thank you so much for joining us on the program. Your insight was absolutely incredible. Once again, for everyone watching, thank you so much. And for the Markets Hunter audience, all the links, I will include her website, John's, all the information to the upcoming conference as well in the links below. When this airs, this will be airing several times this week. It'll be across all platforms. So if you miss us on YouTube, you can go over to Twitter. If you miss us on Twitter, you can go everywhere else as well. So and that's helpspotrun.com, and it's Dr. Marie Bartling, and who is our guest today. So thank you everyone for joining us on another episode of Markets Hunter, where we bring you the best coverage anywhere else on the street. Take care, everyone, and have a great rest of your week.